Good morning, everyone. I'm Shauna Monterey. I'll be your moderator for today's amazing panel. Please note that this panel is being recorded, so we can distribute it to you and to those who might not have been able to attend this webinar. We'll be sending you the link shortly after the webinar. So a little bit of background. So as an industry, we're starting to see an influx of emergency use authorization, RUO transitioning into clinical and IVD, software as a medical device, IVD, clinical decision support software. And we thought as a collective group here that with all the different guidance documents and standards such as pre-market submissions, verification and validation, ISO 1345, 62304, IC 62366, like you name it, it might be difficult for those entering the industry or even for those that are currently in industry to know where to start. Like where do you start with all of that? So a few recommendations before we dive in that you can refer to later, some good references that we like to refer to. One is AMMI for those new to medical device. One of my favorites, my personal favorites, is 62304. But in addition to that, us here from a BeanStock perspective, we will be providing what we call our SOAR training, which is going to be regulatory specific to the software industry focused and taking that agile approach to adhering to the regulatory requirements. Jama also has a lot of great tools and resources target for the medical device industry, and Agile Quality Systems offer customized training and consulting. As a follow-on, we will be sharing additional resources to help. There was a lot of questions coming in, a lot of topics of interest. It's just too much to cover in an hour, so we'll do our best to give you kind of our bird's eye view of the current environment and the situation, and then we'll follow up with additional resources based on your interest. So before we start, I'd like to do a quick poll. It'll only take you a couple minutes, and I'm going to ask you about your experience with Agile and then software as a medical device. So I'm going to go ahead and start the poll. Okay, so I went ahead and started the poll. I did receive a question from the audience. Are we all muted? Everyone's muted. So we can't hear your background noise or your dog or your kids. so we're good there. But thanks for asking. We'll just wait a few more minutes. It looks like we're getting good responses here, 170 out of 203. So we'll just continue on until give you guys about another half a minute. Okay, so let's go over the results. I can share this with you. I don't know if you can see it on my screen. But we asked the question, on a scale of 1 to 5, rate your experience with medical device guidance, standards, and regulations. So we have a 5% with little to no experience, 12% limited experience, average experience 32%, above average 37%, and expert 13%. The second question was, on a scale of 1 to 5, rate your experience with Agile software development methodologies. So little to no experience, 10%, limited experience, 18%, average, 30, 32, going up and down, above average experience, 31, and expert experience, 8%. This is great. Thank you for providing this feedback. So now I'm going to go ahead and let the panel introduce themselves. I'm going to go ahead and start with Kelly. So Kelly, if you don't mind giving us an introduction. Oh, Kelly, I think you're
Hi,
muted.
everybody. Yeah, hi, everybody. Welcome to the webinar. I'm Kelly Wyrock of Agile Quality Systems. I'm a consultant working primarily with medical device manufacturers and healthcare systems producers. I help organizations build and adapt their quality management system to be aligned with regulations and standards. And I provide Agile development training and coaching, both at the team level and at the enterprise level. And more commonly for me is the combination of the two, working with medical companies that want to bring Agile into their organization and align it with their quality system, which often has to change to adapt to Agile. We're going to be talking a little bit about that today. In addition, I was the lead author of a document we're going to talk about today, AMI TIR45, a guidance on the use of Agile development for medical device software. So we're going to be talking a lot about that document today. I was on the committee that wrote it. I was one of the primary authors, and I teach the course that Amy provides every year.
Thank you, Kelly. Adam.
Hi, good morning. My name is Adam Darmstadt. I'm the VP of Product Development at BeanStock Ventures. I'm responsible basically for all aspects of product developments with our clients. And we're trying to do this in a very iterative, agile approach. And some of my learnings I can share maybe as well.
Thank you, Adam. Clay.
Great, and hi everyone, I'm Clay Moore. I'm the VP of Customer Success for Jama Software. At Jama Software, we provide solutions for requirements, risk, and test management. My specific area of responsibility with customer success is professional services, as well as customer care. So I have responsibility for the folks who assist our customers in understanding the processes you're trying to use and then prescribing how we use Jama to facilitate that, and then the teams that provide the long-term care and support of your organizations.
Thank you, Clay. So throughout this panel, feel free to ask questions throughout the presentation. Please try not to use the Q&A. Please use the Q&A actually, and not the chat, so no one gets missed. If it goes through the chat, it's kind of hard to manage. If you put it through the chat, that's fine. We'll try to catch it. But please use the Q&A feature to ask your questions. Okay, with that, we're going to go ahead and jump right in. So there's a myth that Agile development is chaos and that requirements and designs are not required. How do we debunk that myth?
Well, I'll take that one right away. That was one of my first impressions of Agile when I was first exposed to it way back, even in the late 90s, before Agile was even the thing. We were hearing about these lightweight methods that just didn't sound appropriate to the medical device world. And we had some of these same misconceptions. Well, it's just flat out wrong. The Agile Manifesto talks about valuing some things over others, like working product, working software over comprehensive documentation. It's not saying that we don't need documentation. It just says that we value working software more. Of course, we have to have documentation when documentation serves an important purpose. So the idea of Agile saying we don't need that is just flat out wrong. So organizations that have applied that are just misusing Agile and need to learn better about how Agile is supposed to be applied. But then where that comes from is this reaction to what Agile was focusing on, was to try to get away from this heavy emphasis on documentation and rigor and processes that had gotten out of hand. So the Agile Manifesto is trying to encourage us to find the proper balance, not get rid of the discipline and documentation that we need, but to get a better balance between that and developing useful working products.
Thank you, Kelly.
All right, I'll go then. I'll jump in, Adam. Yeah, I totally agree with Kelly's perspective on that. It really does. It does matter with aligning this with a particular product or industry that you're in, and really focusing on delivering a working product. But at the end of the day, from a medical device perspective, the reality is requirements and design are required. The FDA clearly established the significance of design input activities. They said the requirements which form the design input establish a basis for performing those subsequent tasks and validation of design, and therefore the development of a foundation of requirements is the single most important device design control activity.
Thank you, Clay.
Yeah, a lot of the documentations, they actually did not only come because of regulations, right? The documentation, they often come from internal needs to communicate. Documents are a communication tool as much as they are, agile backlogs or team meetings and scrums, right? So IEEE in the 60s had already standard for some of the software documentation. So this is how long these best practices go along. And even if you think about you're applying agile at scale with multiple teams, you cannot always have everything only face to face in a conversation, right? You need to document certain steps, certain processes, maybe a deployment pipeline to do a proper risk assessment for cybersecurity, et cetera, et cetera. There are still documentation needs, even in the agile world.
Thank you, Adam. So Kelly, how does TIR45 help address this misconception?
So a little bit more background that given the diversity of experience with regulations and standards, I'll give you a little bit of background. So AAMI is an industry association. It stands for the Association for the Advancement of Medical Instrumentation. And part of what this group does is provide guidance to industry and regulators on various aspects of medical device development. It consists of industry and the US FDA. And there's also a little bit of international presence through their member companies, but the FDA is heavily involved. So what AMI does is provide guidance in two ways. They provide training and they provide technical information reports, TIRs, that give guidance. So TIR45 was created when a variety of medical device manufacturers were beginning to use Agile in the early 2000s and were concerned about what the regulators would think. So AMI created a committee that I got on when I was working at Medtronic to create this guidance document. So the document talks about how you apply Agile in the context of a medical device industry, in the context of regulations. It addresses key elements of agility and how you can apply them and still meet the expectations of regulations. It clarifies, for example, what the role of documentation is and how you produce it in an Agile way. It describes how you do iterative development and produce the artifacts necessary to demonstrate that you're in control of your quality management system.
Thank you, Kelly. So we have a question, our first question. How do we balance the trust in Agile with the need to provide objective evidence and regulations?
Interesting question. That objective evidence shouldn't imply that we have to demonstrate that we are trustworthy. What we have to provide for objective evidence, those who aren't aware, the regulations require that we provide evidence for things. We need to be able to demonstrate that we are satisfying the regulations. So we need to provide artifacts that can show somebody from the outside that we are in fact in control of our design, that we've done the proper activities, we've done the things that convince ourselves our products are safe and effective. So while trust in Agile is about trusting the teams to do the right thing and design systems and design their processes and adapt them as they go, we still need to provide artifacts that demonstrate we've done that. So we're going to get a little bit more into that when we talk about documentation later, how we produce the evidence as we go in an Agile model. But it doesn't imply that we're producing evidence just to prove that we're trustworthy. We're providing evidence to be able to explain to somebody what we've done so they can assess our products.
Yeah, maybe let me add one more thing about the evidence. While even in more traditional waterfall development approaches, teams were using some tools, but especially with the fast iterative agile approach, you have a lot of focus on test automation, etc. And you use backlog tools that trace stories to epics to larger items. So you have a lot of evidence even within your tools that just part of your day-to-day work. You don't need to even worry about creating extra evidence. It's just in the tool.
Those are great. Yeah, I think that I'll hold off on commenting on that until we talk more about the documentation and the tool section.
Thanks, Clay. So we do have a question about waterfall, which kind of leads into another question that I had. So we're seeing a slow shift in adoption from waterfall organizations who still follow this stage gate process, right? This PDP process, to purely Agile software teams. I mean, Agile, I think for now has been, at least from what I've seen, it's been industry adopted for software teams. This is the way we do software development. So what are ways a software team can maintain its agility while still meeting the corporate product development expectations?
I'll jump in on that, if that's okay.
Sure.
Good. Sure. Yeah, I think our concept of what is delivered at each stage needs to change. You know, instead of having one preliminary design review and one critical design review for the entire product or system prior to development, you know, orgs really need to have a higher volume of mini stage gates for smaller slices of the system. That might mean a specific function or feature. And these can be more informal design reviews that happen during each sprint, which ultimately are helping to build momentum toward what you would traditionally view as a critical design review at the end. And I think what's critical about this is that it means you aren't locking in design choices and constraints up front before the development begins. You're really allowing yourself to have lessons learned and discovery of more optimal design choices along the way, which ultimately supports responding to change or following a plan.
So I'll add to that that the intersection really depends on what your quality system is requiring and how prescriptive it is and how flexible it is. Many organizations have embedded a linear model in their quality system, that the quality system demands that things are done in a certain order. And when you have that kind of rigid constraints, agility really challenges the quality system, because agility recognizes we don't do product development in a linear way. When I'm consulting with organizations that have this heavy linear process, I ask them, is this really what you do? Do you only talk about requirements for a while, or do you move on to design while you're defining your system? Do you really complete everything before you go into validation and verification phases? And the answer is usually no. These linear processes to the extreme are simply not reflective of how development is really done. On the other hand, if your quality system is rather flexible, it highlights what has to be done, but allows some flexibility of when you do it and how you break up the work. Your development plans can say, this is how we meet the expectation of our quality system, but doing it in an iterative evolutionary model that the Agile models describe. So how you make them fit depends on how constraining your quality system is. Perhaps your quality system needs to change to be more reflective of the realities of product development being more iterative, and the specifics of how you want to apply agility. This notion that the FDA assumes linearity is simply not true. The regulations are quite clear in saying that the manufacturer has to define their development process and their development model. One of the guidances from the FDA in particular talks about concurrent engineering has been a best practice for a long time. We should not assume that the regulations demand linearity.
Yeah, maybe I have two topics I actually would like to add here. One is that very often your PDP process that you have is not only with regulatory aspects, it also has business aspects. You have your stage gates, you look at your feasibility, and then upper management often decides, are we gonna keep funding that program or that project, right? So the regulations, they don't require that kind of a business process, right? So you can decouple the regulatory aspects of your PDP into a more business aspect. And one example might be you do this on quarterly reviews or whatever your timeline might be, instead of at certain phase gates, which might be even more practical. The other aspect I think I saw in the question a little bit is that it's often not only software alone projects. You often have projects in the medical device world that have a combination of hardware and assays, right? So there you can synchronize, maybe at the same quarterly iterations, your product increments. You can synchronize the different teams on what are the next development goals, and focus really on the interfaces between the teams, what you want to accomplish for the program, and then what each team can contribute then.
So I want to add one more element to this, that these assumptions of linearity have embedded that we have to have design reviews at certain stages, like we have to have a design inputs review and a design outputs review. Well, the regulations require that we have design reviews, but the regulation says they are done at appropriate stages. So what is an appropriate stage? In a linear model, it's the phases. And so design input review makes sense because that's a stage in a linear model. And the design outputs or design validation review, these are appropriate stages in a linear model. But in other models, such as an iterative model, a stage is simply an increment. In the Agile model, an increment is a stage of development where we would have a design review. And as in contrast to the linear do a design inputs review followed by design outputs, in the Agile model, you have design input and design output reviews at every iteration. You have them all the time. It's not one big phase. It's a constantly proceeding flow of design inputs being defined, product being designed, and more definition, more design, more definition. It's a constant cycle. So we have these controls embedded, but in a different way in an incremental model. There's nothing in the regulations or standards that say we have to have these phase gate milestones. That's a choice that manufacturers make.
Yeah, that's a good point. And I really like what Adam said about decoupling the two things, right? Like from a business perspective, it may make sense to have a review, every 6 months or even a year, whatever that ends up being. Some of these product development cycles are quite long, right? And so to get feedback on the design, have formal design reviews, or let's just say design reviews, I don't have to put the word formal in front of it, it's too late, right? And so it makes sense to brief the business to say, hey, this is where we are, here's our risk, do we want to continue to reinvest, do we need to pivot, is the market changing, that type of thing. But to have those reviews, and you see a lot of times with the teams, they'll actually delay the reviews until it's actually required. Oh, the design review is not required, right? But for this iterative approach, Agile, you're constantly reviewing, right? So you're constantly, improving the quality. So with that, how does Agile improve product development in terms of quality and safety?
Again, I'll highlight a couple things from my experience with the TIR committee. There were FDA people on the committee that created the document. They were a little bit aware of Agile coming in, but not a lot. And so as we were working on the document, they learned more and more about the Agile process. And there were two things that they really liked, leading to a summary that I want to explain. First of all, they really liked Agile's approach to continuous verification, continuous integration, putting a lot of emphasis on building in quality as you go, as opposed to this big bang verification activities that happen at the end when it's harder to adjust to changes. Similarly, they liked the Agile approach to continuous validation. One of the concerns that regulators have seen with validation being done at the end is when we find problems at the end, they're harder to correct. And that leads to two bad things. We either are willing to accept flaws because we're so late in development, we don't want the risk of introducing problems, or you do make fixes and you introduce problems by making those fixes. And so when they heard about how Agile emphasizes continuous verification and validation as you go to find bugs before you get to the end, they really liked that. All of that came together into one key phrase we heard from one of the leaders of the FDA software world, John Murray, who was one of the main authors of design controls and contributed to the design control elements of the regulation. He said over and over again, the essence of design controls is to be in control. And what he really liked about the Agile model was demonstrating control every step of the way. Agile teams are in control every increment, every sprint, every story, every day. There's multiple levels of control that really impressed the FDA.
I think a great practice that we see is that Agile teams, they work together to proactively write and review the requirements and user stories together, which helps them build a shared understanding amongst that team. And increasing that shared understanding, it really allows us to provide context and increase safety throughout the entire process. If people who are actually building the product have a deeper understanding of the safety requirements, they're more likely that their product is going to meet or exceed those safety levels. And we firmly believe that orgs should be striving to incorporate those safety requirements directly into the Agile team's framework.
Yeah, so the review happens basically very organically. So I think you can very easily, in like the definition of done, in your description of your epics and stories, you can just document, you've done your risk assessment. These are the things that you want to consider here. And you can do this at the beginning of a increment or at the beginning of every sprint, so you know what you're planning for forward. And you're really in control that way.
Well, there's a good question here, kind of to add on. We talked about quality and safety. It's kind of loaded. I'll summarize it after I read it. In a work culture that values predictability of the product development, in other words, being able to confidently predict the scope, cost, timing of a project is important. My primary concern with Agile, based on my experience, is that it offers poor accuracy in predicting project success. How does one balance employing Agile methodology alongside predicting project timing accuracy? So before we jump in to answer that, I would kind of put something out there for the panelists, is that I would see that as being actually a myth, the predictability using Agile versus this traditional approach. Many programs that we've planned out, usually what ends up happening is the launch date is fixed. It's going to launch in this date, and here's your budget, and you have to work within that fixed constraint. What Agile, in my opinion, allows you to do is to be able, with that fixed constraint, that business constraint, is to be able to constantly monitor and add and reprioritize scope in order to get to that end milestone, right? So when you're building the software in this incremental way, you have these incremental releases, and essentially at that point you can say, okay, we're where we are, we think this is going to satisfy the market for release 1, and shortly after we can have, you know, a release 2. At least that's kind of my perception of it, is it really helps you manage scope better. When you plan out these fixed programs, the scope generally gets fixed and doesn't get renegotiated, which causes delays down the road, and releasing a product that has features that aren't that important.
I really like this one because this one speaks to my history of agility. When I started using Agile methods when I was at Medtronic, and we were making a big shift in how we developed software products. And what motivated that shift? You have to have a reason to want to do something different. And our biggest problem back in the late 90s was predictability. Our product development organization was not regularly hitting milestones. We were continually revamping schedules, breaking and changing commitments, and it was frustrating the business. They wanted more predictability. What Agile highlighted is a different kind of predictability. If you think predictability is to try to predict the future a couple years out, to define exactly what you want and deliver exactly what you said in a cycle that takes months or years, when I hear people say that, I say, how's that working for you? Are you able to do that? The world we're in today changes way too fast to be able to have that kind of predictability. Agile instead talks about establish your target, make progress towards your target, and accept changes as they come in and move with it as changes happen. Don't try to tame change, embrace it as a natural thing of doing product development in today's rapidly changing world. And Agile provides mechanisms to be in control of those changes. So perhaps predictability isn't the right word. A better word might be adaptability, that we can respond to changes in a healthy way that still meets the business needs to be predictable.
Well, I think what we see as well is when Agile is initially rolled out, obviously the ability for teams to do estimations and other activities that are related to that are less precise than they're going to be longer term. So I do believe that we see an increase in predictability over time as teams get used to the flow of that and understand what their working life is like together.
Yeah, maybe an interesting aspect based on your organizational culture. I've seen organizations that don't even estimate stories in size. They just, after they break it down, they realize counting stories is as good as a metric as estimating them. So you need to see in your organizational culture how your team is working and how you want to estimate it. But back what Clay said, it's really the you have your backlog, right? And it's that trade-off that you want to make, right? You're predicting not only that you get all those features done, you're also predicting that you get the right product done. And what that right product is over a course of a longer 3-year, 5-year development, that might change. You want to adjust your backlog with the more important things.
Thank you, Adam. So I'm getting tons of questions about regulatory being a burden. So that kind of jumps right into our next topic. So some of the pushback we've seen between software and quality teams, or even just software teams and the business, is that on the basis that the regulatory requirements are burdensome, and it can go either way, right? I've seen directors of R&D not wanting to introduce regulation because they don't want to hinder the productivity of the software team using Agile, and I've seen quite the opposite. So how do the regulatory requirements improve product development? Oh no, sorry, how did that happen? Oh, so. So how does the regulatory requirements actually prove development in terms of quality and safety? So this is the opposite of the previous question, sorry.
Yeah,
we know where you're going.
We're seeing some of the same questions. There's a lot of similar themes there. I really like that word burdensome, because I want to ask people to think about, well, why are regulations perceived to be burdensome? It is generally not the regulations that bring the burden. It's an organization's interpretation of them. In nearly every case, when I see an organization saying they have a burdensome process, it's because they did it to themselves. They defined their process. They defined the documentation requirements. They defined the sequencing of things and the rules behind it in a way that's burdensome. The regulations are not intended to be burdensome. However, if you're coming from an organization, as an example, from consumer electronics or consumer software, where time to market is key, and it's okay to have bugs in the field, if you've developed a process that allows you to ship products with bugs and fix them later, that's generally not acceptable in the medical device world. So perhaps some additional burden is what you need. So you should find the right level of burden. The burden should be the things that help you do development well. And the burden is worth it. It's either a natural byproduct of doing good work, or it's some things that provide some rigor that would actually provide value to your organization and the products you develop. So it's about finding that balance of useful process and in a way that's easy to produce the artifacts to demonstrate that you followed it. It should be as burdensome as it needs to be and not feel burdensome. If it feels burdensome, you're probably doing something wrong.
Yeah, I agree. So it's really the timing and the magnitude of what you have to do. And I think the issue here is, for me, the interpretation is always, we're doing the documentation for the regulatory purpose. And I want to have a different mindset. As I said earlier, it's really for team communication, right? That it's for business continuity. What if you have a product version 1 brought out and you need to create a maintenance release 2 years down the road? The team might have shifted. How do you onboard a new team, right? And maybe at the end, we all are customer of our own products, right? At some point, we might get diagnosed or treated with the same products. You want it to be a safe product, so you do it for yourself as well.
Well, it's burdensome if the documentation seems extraneous to the process itself. We want the documentation to ultimately be a byproduct of the process that we're running. And I think that the FDA wants they want the regulation to be empowering. Design controls are meant to empower managers and designers to get visibility up front in the process and to enable them really to more effectively direct the design process. And those design controls really should increase the likelihood that the design transfer to production will translate to a device that is appropriate for the intended use.
That's a good point. I think when you start thinking about something's burdensome, ask the question, why? Yeah. Why is this here? Is it useful? And what purpose is it serving? And can it be served in a more efficient way, right? Is there some redundancy in what we're doing, right? So if it's seemed as a paper exercise, and we really need to question what is the value, and it could simply be a gap with the team not understanding the value. So how can software and quality organizations work better to bridge this gap?
Go ahead, Clay. You start with that one.
All right, I'll jump on that one. That's great. Yeah. So again, I think looking back to teams working together on this process, I think it's part of the spirit overall of agility. The regulation requires us to clearly document the process and procedures. So this should really be a collaborative effort to balance the needs of both the development teams as well as the quality teams. So the quality team should focus on just enough rigor to meet the requirements, while giving the flexibility to the software teams to help them to define and develop their approach. And they really should try and align all this effort around values as defined in both the Agile Manifesto and the regulations itself.
So Agile is a team game. Agile is about teams developing good products, and quality needs to be represented on the team. Now, how you do that depends on your organization, how big your products and your development teams are, but quality plays an important role to help develop the process. Agile methods encourage adapting the process to make it effective. And effective includes satisfying regulations and producing evidence that will satisfy regulators. If your quality organization is viewed as the defender of the process, the face of your process to the outside world, such as regulators, auditors, the quality people need to understand how the process works. They need to help adapt it to ensure that it's producing good products and providing evidence that satisfies the regulators. So the simple answer after all that is the quality people ought to be part of the development organization, part of the teams to define the process as you go.
Yeah, and I think all team members need to understand the why and need to align on that. And that means, to me, we need to either cross-train within the team, or quality team members need to have some software, at least Agile training, and vice versa. The Agile software developers, they need to have some understanding of the regulatory aspect. So the shared purpose is available for the team.
Thank you, Adam. So there's a lot of questions around the challenges here. So what are some common challenges applying software agile development methodologies for regulated products? And what are some ways to overcome them?
So I'm scrolling through the questions and I'm seeing a variety related to the continuous verification and validation idea that I talked about earlier. So I want to try to address a bunch of those. Agile encourages doing little bits of development iteratively, small bits of development, small bits of features through stories, little bits of things being done as we go. And that includes satisfying the quality system. We want to do verification as we go, validation as we go, as opposed to these big bang stages that we're used to. In particular, there was a question about validation having to be done at the end, because the regulation says validation has to be done on production units or their equivalent. Note that it doesn't say that for verification, and many companies assume the same thing with verification. But what that means is some validation has to be done on final units, but not all. It is possible, in fact, desirable to validate early as you go. In the Agile model, you do it little bits at a time. Every story produces verification evidence that that story was implemented correctly. If it's possible to validate that small thing by showing it to a customer, getting feedback, do that. But that's often a little harder. Validation often happens when big system elements come together. When stories are small bits that customers don't see, it's hard to validate that with a customer. Instead, we collect things and do some validation when we have an increment of something worth developing. But it's not just at the end. It's at increments as we go, as planned by how your increments are organized. One more element of that was the documentation of that. And are we a little bit ahead with the questions, or should I jump into that documentation topic?
No, let's jump right in.
So one of the elements of TIR45 describes how documentation is produced. And there's a nice diagram that describes what we called the sum of the parts model. The documentation gets produced little bits at a time, and then we aggregate those little bits into summary things. So for example, requirements are created in the Agile model as you go. You do some definition upfront as part of creating the backlog. You refine it as part of delivering backlog items, and you document those requirements little bits at a time. The requirements related to a feature, the requirements related to a story, and we build them little pieces at a time. And we review and approve them little pieces at a time, individual requirements, small sets of requirements. But then at some point we aggregate the set to review and approve them as a set. This is where you address things like, do we have all the requirements? Are they complete? Are they consistent? Are they coherent? You do this sum of the parts documentation to collect all the pieces and review and approve the document as a piece. Essential to this is good tools that allow you to create the content little bits at a time, review and approve it a little bit at a time, and generate the aggregate summaries, a complete document that you review and approve as a set.
Thank you, Kelly.
That's great, Kelly. I think the other thing that I like about that section in TIR45 is the concept of the project layer versus story layer, and the amount of documentation that's required for the story layer, and perhaps maybe the how you make the sausage layer is different than the amount of documentation, the type of documentation you need at the project layer to provide the context on how decisions were made and why they were made.
Adam, do you have anything to add about supporting regulatory documentations and Agile development, like best practices?
Yeah, I mentioned earlier the tool suite. So often the documentation comes out of the tools, right? I think Jama has a great suite where you can build in your own corporate templates and create the documentation. Yeah.
Thank you, Adam. I want to add one point about the validation aspect of it. And I think this is kind of a general theme with the FDA, with regulated products, right? The whole thing is that nothing's mandated, right? So if you do a validation and you make another change, it's up for the business to look and assess that change to determine if it warrants another validation or a mini validation, right? It doesn't require the product to be 100% feature complete, right? So that's a business decision. And so it does have to be equivalent which means you do have to show, okay, these changes from here to here didn't introduce any differences in these results from the last validation, right? And to be able to do that. And as experts, it's within the company's discretion to be able to make that determination, right? With the key experts and maybe even, you know, surveying a subset of the users if necessary. But I think there's a, you know, kind of an idea that it has to be completely 100% complete before you can actually do a validation. And if it's not 100% complete, then you have to wait all the way to the end. And what that does is it just pushes out the timeline another 3 to 6 months, right? It's a very costly thing. And so you have to use your own judgment, determine what the changes were and does it impact that study that you just did, right? Does it warrant another study? So we talked a little bit about tools. So we're going to jump right into tools. Well, let me see if there was one question here that was a loaded one that was, I want to.
The one about validation.
Validation.
No, we did the validation.
I saw that one earlier as well.
Oh,
yeah.
No, tool validation.
Tool validation, yeah.
We can touch on tool validation when we get into tools if you guys want to chime in on that one. There was one that, here we go. This is a good one. So how should compliance communicate and orchestrate design changes in an agile environment, since many design changes may require filing to FDA or minimally require an evaluation and summation of the decision not to file, including software changes? So it seems like the agile methodology is fine for a defined, agreed upon set, but adding epic stories and backlog items could be difficult for regulatory.
So this is where the regulatory strategy, how your product is regulated, how you do submissions, factors into how you organize the backlog and define releases. There are times when major new features, new additions require a new filing, and you should plan those with the burden that comes with that. We have to produce the evidence and submit to the regulators, wait for approval, often have some approval cycles. That factors into these major releases. But not every change to a product requires a new filing. And so in your planning of the backlog and your planning of releases, decide which things can we make minor changes to, minor fixes, minor corrections that don't require a brand new filing, might just require a letter to file, and which things require a new submission. And plan your backlog and release plan accordingly. So you factor your regulatory strategy into your release plan.
Yeah, in my past, I've been in conversations where some team members are considering a small software change, a design change per se, right? And I think that is changing the software is not always a design change in the meaning of design in a regulatory context.
Yeah, I think just to build on that concept that Kelly was talking about, you need to determine what your release cadence is going to be, and not just externally market facing, but internal as well, right? And so some of those internal release cadences are going to be where you can start to accumulate momentum, but obviously there are other regulatory concerns when you're actually producing a product and delivering it to the market.
Yeah, that's a good point.
Thanks for bringing that up. There's a couple of questions talked about that incrementalism of what are the states that you have to do these new activities, and it needs to be factored into your plan. That not all change requires a complete new verification and validation effort. You need to build that into the plan.
Yeah, one thing I like to do is when there's a release coming, using the backlog to help me manage that release, especially if I know it's going to have a 510K submission, then I know, okay, it's 510K submission, that's going to take a while, so I should include other features into that to make it worthwhile, right? We're opposed to like a maintenance release is treated a little bit differently, and then just kind of managing that, but using really the backlog, the epic stories as a tool to facilitate that. There was a question about risk management integrated into that process, right? Does this affect, the clinical diagnosis, right? Does this affect safety? Does this affect usability, right? And some of those questions can help with your, quality and regulatory department, help you determine what would warrant a filing or not, right? So the team can kind of look at it themselves. Obviously, quality and regulatory would make the final decision, but if the team's trained on that, they should be able to look at things to really know if, they suspect that it's probably going to warrant something much larger and have that bigger discussion with the rest of the business. Now we're going to go on to one of our favorite topics, tools and techniques. So I think we covered some of this a little bit already, so just so bear with me. But there's some fears that if the artifacts are not generated to show evidence of every aspect of the software development process, that an auditor will dive into the tool repository. Oh no. Creating such artifacts create a high burden for the software development teams, right? Adam pointed out that they're already building this stuff, right? They don't want to create a document that describes a subset of what's already in the tool. So what are your thoughts around these fears?
Well, you've got great perspective on the fear itself. I'll talk more about how people leverage the tool to segregate that information.
Okay, so first I'll address the fear and I'll ask, what are you afraid of with that fear? If you are in control of your development process, which agility encourages, you should be in control every step of the way. You will need things to demonstrate control every step of the way. And if you are in control, you should not be afraid of showing that to a regulator. Now, of course, you don't want to dive into the details. You don't want to lead a regulator into the details because it's easy to get confused. It's easy to get overwhelmed by the complexity of incremental development. So it's necessary to think of the evidence you're going to show a regulator in a pyramid. At the top, you have the high-level summaries, the high-level documents, the aggregation things that provide the kinds of things that are in a submission, for example. You don't provide tons of detail in a submission unless people ask for something. You provide a high-level summary and you give them the answer to their question. If those high-level things demonstrate you're in control, you don't have issues with your product, you have a robust quality system and high-level evidence to prove it, a regulator will often stop there. They're not going to ask questions unless they're motivated to. And the way they're going to be motivated is you have a bad product or you're not following your own process. But even if they ask questions, tell me more about this, show me some details, rather than produce another document, say, well, this is the evidence we produce. It lives in this tool, and here's how this tool is controlled. We can explain it to you. Now that you know the high level view, we can explain it to you and we'll show you the details in ways that doesn't overwhelm a regulator. So first, regulators may never go there. Yep. Highlight that one piece of that from the FDA helps teach the AMI course that I talked about on TIR45, and this comes up all the time. They say, what would we show a regulator at this low level? And the regulator's first answer is always, why would a regulator be there? Yep. We're not going to go to that level of detail unless you've got a problem. So you shouldn't be afraid of an auditor going there. They may never, and if they do, you should be proud of what you're doing and show off that you are in control every step of the way. It's not something to be afraid of.
Yeah, I think a key way that our customers try to separate that out is to, essentially separate the definition of the product, the design control and risk management from the implementation and task management. So it's very common for customers to utilize Jama for managing the definition and the planning, while leveraging something like Jira for work item management and being able to, essentially segregate that information. In Jama, we have the context on how decisions were made, why they were made, and in Jira, we have more of the how it was actually built.
A key to all this is robust tools. You have to have robust tools that can manage the fast-paced incremental development model that without tools to control it would be chaos. You need tools to manage it, requirements management systems, source code management systems, test management systems, documentation management systems, and those tools must enable incremental development, allow you to do things small bits at a time, be in control of the small bits, and produce the aggregate summaries that you provide to the outside world to demonstrate control, and do that in a way that feels almost seamless. It's not burden at all. It's a natural output of doing good development. You need good tools to support it.
Yeah, maybe to expand on that while we're in tools is just to touch on the validation question that came up earlier too. And one of the things that partners like Jama do to facilitate the validation of our tools is provide things such as a validation kit, which essentially defines a set of core workflows that you would use in the facilitation of your own process, and then defines the test cases against those so that you can ensure that in validating our tool, you're not, and your use of that tool, that you're not introducing additional risk into your process. Kelly, I don't know if you had some additional context on that to add.
Yeah, I love the question that said that, which the FDA admits that tool validation is a costly process. Indeed, they did, and that encouraged industry to create guidance. And so if you're not aware of it, there's a guidance from AMI, TIR46, which has now become an ISO standard 80002-2 that addresses tool validation. And it addresses this very question. The main premise of the TIR was, why do we see tool validation as non-value added? And the answer is because we went nuts with it. The industry went nuts with it. And the guidance is intended to provide some balance to identify what is the appropriate level of rigor. Some tools require more effort than others. And so if things feel burdensome, it's probably because you've addressed it too burdensome in your own choices. So if you're not aware of those guidances, get them. They help you identify ways to not make validation feel so burdensome.
And this goes back to the question we had earlier, that you need to have a shared team when you define your tool needs before you do your validation, right? So this should not only be the development team. You need your quality and regulatory team members involved in that the tool generates the proper output for your submission strategy. And I think that's often forgotten, that the tools are defined by the development teams in isolation, and then in an afterthought, we're figuring, oh, now how do we create the regulatory documentation, right? And then you scramble, and then you add this extra work that if you would have planned it earlier, you could have avoided.
Yeah, my favorite one is, how do you validate a compiler? That's always a great one.
In the past, how would you have validated Word or Excel? So that's another conversation we have with our customers too, is to what extent do all the things within that tool chain need to be validated? How do they potentially introduce additional risk in their overall process, and collaborating around that?
Yeah, and some of them are already validated through your verification process, right? So you don't have to create a separate validation. You just have to know this is being validated through this mechanism, or this is not being validated because it's, low risk, right? It doesn't impact the safety or efficacy of the product. So I have a good question for you, Adam. There's a couple related to software, hardware, so I'm going to pick on you for this one. It's like, how do we marry a linear dev process for hardware development and an agile process for firmware and software development? What is your experience on how you manage regulatory specific needs in this scenario? I think just the regulatory piece alone is a loaded question, but I mean, it's about the whole integration, right? Like that is a level of complexity. The hardware tends to take longer, firmware follows, and then software, right? So Adam, what's your experience and recommendation there on this one?
Well, one thing I mentioned earlier is that when you do your program increment planning, let's say every quarter, you really have a cross-functional planning effort. So you align on your incremental progress that you want to do, and therefore you can align your development. But yeah, for me, the key is, especially since the software teams, they really want to focus more and more on test automation. It might be a little bit difficult if you always have an instrument that limits your test automation. So I found it very useful to really focus your cross-functional team discussions on the interfaces, and then build a simulator against those interfaces. Now that allows you to do error injection, which might be very difficult to create with the hardware, but now you can actually do it with a simulator, and you can demonstrate that your software works properly.
Yeah, I think the interfaces is key. Understanding, okay, if we have a fan, how are we going to control that fan from a firmware perspective? What's the functionality? Are we turning it on and off, right? Is there other capabilities? Are we monitoring something through a sensor, right? Defining that up front, because you can implement, those pieces of it, and then have a better integrated system at the end, because everyone's on the same page. So the interface is not just from a programming perspective, but also to facilitate, communication as well. Make sure everyone's on the right page there. Great point. So there's a lot of questions here. We're not going to get through all of them. We will follow up with you guys afterwards. We have 3 minutes left. I'd like you guys, if you can, please hang on. We have another poll, and we would love to get your feedback. So I'm going to go ahead and launch that. I do want to say a big thank you to our panelists. Weren't they great? So let me go ahead. I mean, this is a loaded topic, so it's very hard to cover everything in a short period of time. So I'm going to go ahead and open up the other poll. So bear with me. If you guys can stay on, that would be great. Okay, there we go. And once you answer the poll, feel free to drop off. We will be sending you guys an email. We will have a recorded session of this for you guys to reference, also to share. We would love your feedback for follow-on. We do expect to have more panels in the future focused on more specific topics. There's a lot of topics around cybersecurity. We didn't even touch on it. That's its own topic on its own. AI, same thing. So those are things we will consider, and we really do appreciate your feedback and your attendance today. So before we close, for those of you who are still on, I think want to kind of touch on where can we find out more? I kind of touched on it in the beginning, but kind of to reiterate that. So we can start with Kelly. Kelly, can you provide some insight if people want to learn more? Obviously an hour is just not enough.
So a couple things to learn more about medical device regulations in the regulated world. There's a variety of companies that provide training, including BeanStock Ventures. You can get information from AAMI. If you aren't part of that association, I encourage you to go and look into that. If you work in a big company, you are probably already a member, so you have access to some of the materials that they provide. In my consulting business, I do training on basic Agile development, quality systems, and the blend of the two, of how to apply the concepts of TIR45 in your world. Amy provides a course on that. I partner with another organization that takes it further to provide a certified course on Agile for regulated software. And there's a variety of good trainings out there related to fundamental Agile methods. Encourage you to look into those.
Thank you, Kelly. Clay.
Sure, that's great. Jama does have a user community where you can find some great useful resources to access those on your own time. We also provide services and support for training around Requirements 101 for Agile teams, as well as Agile teams for medical devices. And then we also have a suite of services for medical device companies that are really focused around templates and process documentation that supports your pursuit of regulations like 14971, 13845, TIR45, and 62304.
Thank you. Adam, you have 30 seconds.
Yeah, we have, of course, BeanStock with our regulatory training, and we are customizing that with the Agile approach in mind. Kelly and Clay, they had already some resources. Maybe talking about training, I think one aspect is train your executives, maybe on Agile, right? So there are a lot of just pure Agile training companies who help you on that.
Thank you. Thank you, everyone. Enjoy the rest of your day and enjoy the rest of your week. Thank you for attending.
Thank you.
Thanks all.
Hi.